Hi, I'm Dr. Edwin Williams. I'm a board-certified facial plastic surgeon. We have an office on Park Avenue in New York and a clinic in Latham, New York, and St. Thomas in the Virgin Islands. The topic for today's Fireside Chat is how to avoid a blepharoplasty. It's a common question. I happen to specialize in facial rejuvenation surgery, blepharoplasty, facelift surgery, but a common question that I get is how do I avoid a blepharoplasty? The questions that I hear, and this is just to keep me on point because I could talk about this stuff forever, is I have dark circles. What do I do about my dark circles? I've got wrinkles, or the most common complaint we hear is I'm tired of my tired eyes. The first thing is prevention. One, I know this is common sense. If we can maintain and manage our stress level, that makes a big difference. Again, the analogy I typically use is look at our presidents when they go in and out of office. They look like different people, right? And a lot of that probably has to do with stress. And the second probably has to do with sleep. Sleep is a very important part of our health. If we're not getting regular sleep, if we're not getting enough sleep, that can make us look more tired. I think the other is sun protection, by way of either a good sunblock, a total block, or glasses. And if you look at that skin under the microscope, the sun-exposed skin looks just like aged skin. So in other words, the process is identical. So sun protection is another important thing. We don't want to be fanatical and not be able to be outside or enjoy the sun. But what we want to do is to be able to just protect ourselves to the extent that we can. And the other is just exercise, hydration, and salty foods. We know that people who have a lot of salty foods, I'll see patients and they say, well, my eyes are more puffy than they are. And then, of course, if you have issues with sinusitis, make sure you're getting treated. That is one condition that can make our eyes look a little bit more aged. One thing that makes our eyes look better is, believe it or not, moisturizer. There's two things, moisturizer and the appropriate use of Retin-A over a long period of time. Now, what does it take to make skin look better? The scientists tell us you need about a 20% improvement in skin for your skin to look more healthy. And there are only two things that do that. One's real and permanent, and one's temporary. The one that is temporary is a moisturizer. If you simply get good moisturizer, and again, the eyelid skin is much more supple, so if you simply have a good moisturizer, and I would consult with your skincare professionals. We have professionals in this practice that consult with our patients. Every skin is different. Some people have very dry skin, and so they need more hydration around their eyes. But the bottom line is, good hydration on eyelid skin will make that skin look better. Now that's a temporary thing, but it does make a difference. There are resurfacing, light chemical peels. But the other that is a statistical fact and improves the condition of the skin, without question, is long-term appropriate use of Retin-A. That is some of the aging, and I'll come back to answer a few more questions. How to avoid a blepharoplasty? It's a very common question that I get asked. But here's the difference between a youthful face and an aged face. If you take a look at a youthful face, it's a shorter, fuller eyelid. In other words, the eyelid comes to here. If we look at a more aged eyelid, it's a longer, deflated eyelid. And take a look what happens in the configuration in the surface of the skin. I guess my big argument here to my colleagues is that, and when I'm doing eyelid surgery, is where do you draw the line between the lid and the midface? Let me show you another illustration. Look very closely at this illustration here. I had this artwork made for a chapter I wrote a few years ago. Now watch closely. As we age, what happens is that fat pad starts to deflate and sink. The retaining ligaments become more lax, and then we start to see some bulging or puffiness of that orbital fat. So then on the surface of the skin, if you take a look at this individual, here's the orbital retaining ligament, the zygomatic retaining ligament, and it isn't just a matter of having a bag or puffiness in here. The face is actually deflated a little bit. So the answer isn't what used to be done years ago, is just taking out tissue. I think the most important thing is to balance it. This is a picture of me, okay, in 2005, young Dr. Williams. And you can just start to see, and here I am, morphed into myself in 2010. My point for showing you this is as follows. The changes in here are very subtle, but are noticeable. If you look at this quickly, you can tell which is the older Dr. Williams. Okay, so the answer isn't just bags here. There's a lot going on in the mid-face. So we're going to talk a little bit about how to avoid blepharoplasty again, now that we know the aging process. So you've seen now some of those slides and illustrations kind of depicting what the lower eyelid is and the mid-face and how they kind of age together. It isn't just that things come out of the, the bulging occurs with the lower eyes, but you lose some volume in the mid-face. So there are a lot of different options to rejuvenate the lower eyelid by simply addressing the mid-face. Now, about 7 or 8 years ago, there was a popularity of using Restylane right up in what we call the tear trough area. The problem with that is I'm not a big fan of it because it's very, very unforgiving. It's very easy for that to be a little uneven. So what we find is the most consistent to avoid a blepharoplasty is to use any of the other volumizers in the area of the mid-face. So we're adding fill, bringing the mid-face back up, and shortening that lower eyelid complex so things look much better. And again, you can look on our website or whatever, and you can see what I'm talking about there. But basically, any of the HAs work there, but for a period of time, and some people are fans of Radiesse. Sculptra is another good option in the mid-face, and that rejuvenates the whole mid-face lower lid complex. Not to really be used on the lower lid, but in the mid-face. There has been Juvederm, and really gained a lot of popularity is Voluma in the mid-face, and that has really taken off in the last year or so. For the last 15 years, we've also been doing fat transfer. By simply doing a fat transfer in the mid-face, lower lid complex, the entire region, including the lower lid, looks much better. And again, that's really kind of considered a non-surgical procedure because we're not doing any rearranging of tissue or cutting. What if you can't avoid a blepharoplasty? I mean, what if you really have eyes that kind of beyond that? And I would encourage you to visit and consult with someone, a doctor you trust who has a lot of experience with that. But basically, then we're talking about a blepharoplasty. So what is a blepharoplasty? Well, the approach that we take is a little different now. For example, if you think about those illustrations that I showed, that the puffiness from your lower eyes, that's what I call bad fat, the fat that's bulging out. That fat, when removed, doesn't really come back. And then there's the good fat, but that's the good fat, the part of the cheek where you lose volume. So what do we do with that? We remove the bad fat from behind the eyelid. And again, this is done with what we call monitored anesthesia. It's like a little twilight anesthesia, just like you would have with a colonoscopy or something. And so when we take that fat out from behind the eyelid, there are no external incisions, and then we do a fat transfer in here. And then what we do on some individuals is you need to take a little, what I call a smidgen or a pinch or a sliver of skin right up along the eyelid margin to clean and tighten that up to improve the lower eyelid complex. So that's basically how we customize the procedure. Everyone's different, and that's why we customize the procedure to the individual. I hope you found this useful. We have a website that has a lot of answers on there as well, but we've also written a book, Blepharoplasty, everything you need to know about revitalizing your aging eyes. It has all these different options in there, and you can find this on Amazon. All proceeds go to victims of domestic violence. So I hope you found our Fireside Chat interesting today, and we look forward to hearing from you. Thank you.